Most people who are infected with the illness will experience mild symptoms, but there is a serious threat for those who are most vulnerable to the disease. Some will become very ill, and some will die. Those most vulnerable include people 60 years of age and older, and people with chronic medical conditions such as lung disease, heart disease, diabetes, and cancer. If you care for those who are in these groups, monitor them for these COVID-19 symptoms: fever, dry cough, shortness of breath or difficulty breathing, persistent chest pain or pressure, new confusion or lethargy, bluish lips, face or fingertips. If these symptoms present themselves, call their doctor's office and follow his or her instructions. Do not go to an emergency room or urgent care without first speaking with the doctor's office. If you can't reach them, call the Department of Public Health hotline at 636-949-1899 or call 911. It is important that we take precautions with those most vulnerable by doing practical things in the spirit of the common good. Offer to get groceries and run errands for neighbors who are in this most vulnerable group. Respect the visiting restrictions at senior living facilities and nursing homes. Help people with chronic conditions avoid crowds by suggesting alternatives. If you are a family member or caregiver of someone in this most vulnerable group, first and foremost, wash your hands frequently and thoroughly with soap and water for 20 seconds. If you do not have access to soap and water, use hand sanitizer with at least 60% alcohol. Monitor food and medical supplies needed and create a backup plan. Stock up on non-perishable food items to have on hand to minimize trips to the store. And practice social distancing. Refrain from kissing, hugging, touching, handshaking, and even fist bumping. As we continue to go through this pandemic together, it is important to be patient, kind, and to not panic. Take care of yourself and those around you by following good personal hygiene and disinfecting the surfaces you routinely touch, such as your cell phone, keyboard, doorknobs, handrails, and desktops. Again, if you have any questions, please call the St. Charles County Department of Public Health hotline at 636-949-1899 or email us at health@sccmo.org.